You will notice a lot of red on the latest coronavirus risk map for Ohio. That means spread is very high in most counties. And here in Northeast Ohio, Tuscarawas County is on the brink of turning purple. That's the highest level.
It's those rural areas like Tuscarawas that have Governor Mike DeWine most concerned. News 5's John Kosick joins us now. And John, that concern has to do with strain on the hospital systems there.
Yeah, the larger hospital systems, the larger population bases have those larger hospital systems that can help absorb the workload in the event you see a spike in cases. It is a safety net, though, that rural Ohio hospitals do not have. The new color-coded coronavirus map of Ohio shows a sea of red, a color once seen only in the state's largest counties, now sprawling across almost all 88. As a result,
it's taking an enormous human toll on our healthcare workers,
especially in rural Ohio.
There's some hospitals that are at capacity when it comes to what they've allocated for COVID specific treatment. And so what they're doing is some of them are making adjustments to convert other areas of the hospital or the facility to take on more COVID.
The Ohio Hospital Association is in constant communication with its member hospitals, who are in constant communication with others in their region. Ohio is broken up into 8 of them working together should patients need to be diverted if they're reaching capacity.
We saw a lot of that activity early in the spring when there are some surges happening around the prisons and in nursing homes. We saw that type of coordination happening to make sure patients got to facilities that were able to take them.
Let's put the rural numbers, though, in perspective. This is a list ranking the counties where there is the highest rate of occurrence. Of the top 12, only one, Allen County, has a population greater than 50,000. Number 1 on the list is Putnam County, just west of Findlay. The 429 cases they've seen over a 2-week period is small compared to, say, Cuyahoga County's 4,700, but their population's a mere fraction of the size. So that's equal to 1.2% of all their residents getting COVID in just a 2-week period. That same percentage, if it was in Cuyahoga County, would equal 15,000 new cases. And again, that would be just over a 2-week period. Now, the issue isn't beds, ventilators, PPE. Those things can be produced. The issue is people, nurses and doctors that can only work so long and so hard. And though Ohio was in a position in the spring to send those healthcare workers off to other states to help them handle their workload, it's a favor that those states likely would not be able to return given what we're seeing taking place nationally. In Shaker Heights, John Kosick, News 5.